So this is the newborn CPR. CPR procedure. First is to evaluate newborn's transition to extrauterine life using Apgar score. This is done to provide an estimation of how well the newborn is adapting to life and to immediately address any problems that may occur, especially if the baby's Apgar score is low. So let's say that the baby had a score of 5. This means the baby needs immediate resuscitation. So the next thing to do is to check for responsiveness by tapping the shoulder, rubbing the soles, and calling out name loudly. This is done to determine this problem and address it immediately while tapping the shoulder and rubbing the soles of the feet can stimulate the baby to slow sign of consciousness, such as crying, especially if the baby has a hearing impairment. Hey baby, wake up, wake up. Hey. If there is no response, position the newborn on his back and call for help to activate the code blue or the doctor's wave to signify that there is an emergency situation and need for help. Hey you, the blue one, please call the doctor. Tell him that this is an emergency. And then opens the airway function if necessary to maintain the patient airway and to improve oxygenation by removing the foreign material from the mouth and throat. So assuming that this is a function, help the head of the baby and then remove the foreign mental. Positive pressure ventilation using pediatric bag valve mask initiated the apneic and bradycardic. This is done that there is a direct oxygen support to facilitate functioning of the body. So attach the BVM oxygen to the cylinder with 100% oxygen and then covers the entire mouth and nose with BVM. So assuming that the BVM was attached to the cylinder to produce a oxygen to the patient and then holds the mask. Then allow 30 seconds of ventilation or 40 to 60 breaths per minute to allow the oxygen to be circulated through the lungs and the body. And then look for the chest rise with each bagging. This is done to assure that there is an adequate airflow to the lungs. And then have someone to attach the cardiac monitor and pulse oximeter to buy time and save energy, and to have an immediate assessment of the heart rate per minute and as well as the oxygen saturation. Hey you, please attach the cardiac monitor and pulse oximeter. Do gentle chest compression if heart rate is still less than 60 and after 30 seconds of PPV to keep reviving the heart. Use either 2 to 3 fingers or 2 thumbs technique when doing the compression. Place compression fingers at the center of the chest, just below the nipple, and then press down approximately one-third the depth of the chest, one-third the depth of the chest, and then observe 3:1 compression to ventilation ratio, completing the 4 cycles in 2-man rescuer. 1, 2, 3. 1, 1, 2, 3. 1, 1, 2, 3. 1, 1, 2, 3. Evaluate the heart rate after 4 cycles to know whether to continue giving CPR and ventilation. If heart rate is still less than 60, continue the chest compression and assist in intubation and giving meds. So if heart rate is more than 100, proceed to the number 9 step. So do post-resuscitative care and then this is done to prompt identification and treatment of the cause of the cardiac arrest. And then document the time procedure assessment response to the treatment and medications given. This is done to confirm that the procedure was done to the patient, and it can also protect us against from lawsuit, and it is indeed essential for communication of healthcare team members to acquire baseline data and deliver a great care to the patient.